Hello, and welcome to the podcast. My name is Tia Badger. I am a public health nurse, registered nurse, and current nurse practitioner student. I live in Fairmont, Minnesota, and advocate for rural healthcare access and equity throughout southern Minnesota. This podcast is going to be on why it shouldn't matter where you live to get the care you deserve. As a nurse and student nurse practitioner growing up and serving in rural Minnesota, I've seen firsthand the devastating consequences of healthcare inaccessibility. In Martin and Faribault counties, too many of our neighbors or family members, coworkers, and friends are being left behind simply because they live too far from a doctor, a dentist, or mental health provider. It's not just inconvenient, it's unjust. The lack of access to affordable and comprehensive health care services is one of the most critical and preventable crises facing rural communities today. This issue is especially urgent in our counties, where health disparities are worsening outcomes for already vulnerable populations. The Black, Indigenous, and people of color individuals, low income families, and those in isolated communities are the most impacted, yet often have the fewest resources to advocate for themselves. I'm calling on our state and local leaders to support the development of a local health clinic and a mobile health unit that can bring care directly to the people who need it the most. These aren't luxuries, they are lifelines. A mobile unit staffed with nurses, nurse practitioners, mental health counselors, and addiction specialists could meet people where they are, literally and figuratively. Whether someone needs a routine physical, a dental checkup, mental health counseling, or substance use treatment, this model of care ensures that no one falls through the cracks. We know when people delay care or forego it entirely, their health gets worse, their options shrink, and the cost to the community increases. But when care is accessible, early, and community based, people thrive. Kids can focus in school, parents can stay healthy enough to work, our elderly can age with dignity. As a future nurse practitioner, I believe deeply in preventative, holistic, and community centered care. I also believe we have a moral and professional responsibility to eliminate the systemic barriers that perpetuate health inequities in rural Minnesota. This is a call to action for policymakers, healthcare systems, and community stakeholders to invest in solutions that reflect the dignity and worth of every person in Martin and Faribault counties. Let's build a model of rural healthcare that leads with compassion, equity, and accessibility. Our communities deserve nothing less. Help me support this.